Noon, that cruise ship that has been idling off the coast of San Francisco is now on the move. You can see it's making its way to Oakland, where thousands of passengers will finally be unloaded. At least 21 people on board have tested positive for coronavirus. Workers at the Port of Oakland are preparing to whisk all the passengers away, either to military bases or back to their home countries for still a 14-day quarantine. NBC's Tom Costello continues our coverage.
This morning, 3,500 people on the Grand Princess cruise ship will disembark in Oakland, California, after being ordered to remain at sea so coronavirus test kits could be delivered. Of the just 45 people tested, 21 have confirmed cases, 19 of them crew members. All guests will remain in isolation for 14 days. It comes as the State Department issued a warning on Sunday that Americans, particularly travelers with underlying health conditions, should not travel by cruise ship. While here in the U.S., anxiety levels are rising from coast to coast, along with the number of cases. 2 members of Congress are now under self-quarantine after coming into contact with people who tested positive for the virus. Senator Ted Cruz of Texas and Congressman Paul Gosar of Arizona. Neither are experiencing symptoms. Cruz releasing a statement saying everyone should continue to treat this outbreak seriously and be driven by facts and medical science. The announcement comes as the Trump administration is facing criticism for sending mixed messages.
We don't have enough tests today to meet what we anticipate will be the demand going forward.
The president later contradicting the vice president.
Anybody that needs a test gets a test. They're there. They have the tests. And the tests are beautiful.
The government has not released official numbers, but a watchdog group called the COVID-19 Tracking Project says just 3,200 Americans have been tested, compared with 188,000 in South Korea and 18,000 in the UK, where there are far fewer cases. Also today, cancellations and postponements are really increasing nationwide. South by Southwest in Austin canceled now. That's going to be a major economic hit to the city. The BNP Paribas Tennis Open out in California, that is also at this point canceled. Serena Williams among the names it was going to play. And we also want to make the point that the Division III NCAA basketball tournament at Johns Hopkins University in Baltimore, that now is going to be played without spectators as the concern continues to increase. I'm Tom Costello in Washington. Back to you.
All right, thank you, Tom. New at noon, Evergreen Health in Kirkland is reporting 2 more patients have died from coronavirus since yesterday, bringing the total at that hospital to 17 people. We're still expecting another update from state health officials in a couple of hours. As of right now, there are 136 confirmed cases, including 19 deaths. 16 of those people who died were at the Life Care Center of Kirkland, and we should get an update from that nursing home today as well. A team from the CDC is now helping with the response there. Life Care was provided with enough coronavirus test kits to test every resident inside. They've been doing that, but so far no results have been reported. Families who are concerned about their loved ones still have questions.
We feel like we're still in triage in what's happening here, that we're still working on the initial problem, and sometimes updating charts and informational things may take a back seat to other needs that are happening within the facility, and that may slow things down at certain points.
The center says it was not given enough tests to check the staff for coronavirus, and a spokesperson says they're working with different agencies to figure that out. So you might be asking yourself, how do I get tested if I think I might have coronavirus? King 5's Amity Idrisi is at the State Health Lab where testing is happening now.
Previously, if you wanted to get tested for COVID-19, you had to have either traveled or been in close contact with someone who had traveled to an area where coronavirus is present and had some symptoms. However, with COVID-19 continuing to spread, the health department has dropped their restrictions. According to the State Department of Health, healthcare providers may test any patient with symptoms consistent with the coronavirus, which include fever, cough, and shortness of breath. People at the highest priority for testing include healthcare workers, first responders, people with pre-existing conditions or worsening symptoms, and pregnant women, just to name a few. This is welcomed news for people like Kathy Jackson, who believes she may have been exposed to the coronavirus at the Life Care Center. After noticing symptoms, the 71-year-old put herself under quarantine, but she kept calling the health department to get her test results to confirm.
I was not ready for being hung up on. I was not ready for the runaround that I've been getting.
Here at the state laboratory in Shoreline, they will likely be processing hundreds, if not thousands, of tests in the coming weeks and months. But for right now, they're working Monday through Saturday to get it all done. So what do you do if you think you have coronavirus and you want to get tested? Well, first of all, your doctor will make that determination, take a sample, and send it into a commercial lab for testing. Now, we also know that some people who have coronavirus had no symptoms. What do you do in that case? Well, the State Department of Health is suggesting if you are asymptomatic, which means no symptoms at all, testing is not required at this point. Reporting from Shoreline, I'm Amity Adrisi, King 5 News.
And home testing kits for coronavirus could soon be in the works. The Seattle Times reports that the Bill and Melinda Gates Foundation is working with its partners to help local and state agencies tackle the outbreak, but they don't yet have a timeline. Governor Inslee is looking at whether mandatory measures should be taken to contain the outbreak in our state during an appearance yesterday on Face the Nation.
So far, the public is responding very well by making sure that they listen to public health requests. People are now staying home when they're sick. They have telecommuted and teleworked very, very effectively. And so that's working. But we may have to go to the next step. And we are thinking about those seriously.
The governor says that Washington State is going to act based on science to address any issues that come up. Several schools are beginning remote learning this week. That's what will happen in North Shore for the school district for the next 2 weeks. Their superintendent, Dr. Michelle Reed, explaining how it would work in a webinar on Friday. Teachers got training on how to support students from home, and thousands of laptops were delivered to students across the district who needed one. And she says 26 of their 34 schools have had direct or indirect contact with patients infected with the virus. King 5's Natalie Swaby sat down with the superintendent.
Anybody that says, why are you doing this? This is way too big of a step. What do you want to say to them?
I would want to say that we had simply too many staff that fall into one of those 4 high-risk categories to safely open and operate school.
So there are a bunch of schools that are closed with remote learning beginning as early as today or some point throughout the week, including Eastside Prep, Lakeside, and St. Thomas. Bellevue Children's Academy, Willows Prep closed as well. Seattle Academy, the Bush School, and as we mentioned, North Shore. For the full list, you can text the word schools to us at 206-448-4545. With so many kids impacted, we know that you need to get that information.